Prince Harry and Meghan Markle in isolation, and Sophie Trudeau, and Tom Hanks and Kevin Durant. Really, why do sports stars and movie stars get isolated? And why are ministers, councillors and mayors end up in isolation? And why are medical teams at risk? Are the elites at a higher risk than most people? And are they endangering other people? The purpose of this talk is to open a window into the connection between social networks and the spread of the coronavirus. I will use social theory to explain current recommendations for isolation and social distancing, hopefully with a clear logic. I invite network researchers from other universities to add their voice to this burgeoning conversation. It's important. So the corona and us, and the social connections between us. Let me introduce you to the theory of social capital and social networks. I will focus my talk on connectors or bridges in social networks. These are people in central positions, those who connect otherwise disconnected social circles. The origins of this theory lays in an important book which laid the foundation for our understanding of the spread of the corona. Though sociologists studied the spread of medical innovations, the spread of the coronavirus follows similar social laws. The classic study, published in a book form in 1958 as The Diffusion of Innovation, followed the spread of new medicines. On the one hand, pharmaceutical companies are pushing physicians to adopt new drugs which promise to improve their patients' recovery. On the other hand, the new powders are supposed to replace a well-known drug that doctors trust. Thus, new drugs position physicians under uncertainty to adopt a new drug or not. In the book, Coleman, Katz and Menzel examined the spread of new drugs as a function of physicians' social networks. They found that physicians on the fringes of social networks hesitated in facing uncertain situations created by new drugs. They waited for the decisions of their prominent colleagues. After central positions have adopted the new drugs, they have mimicked them. The doctors on the fringes were basically conforming to decisions by central physicians. The innovation spread from center to periphery, from stars to isolates. Either way, the study identified connectors, bridges, or opinion makers at the center of the network. They were the ones driving the spread of innovation. The authors concluded that central physicians in social networks are the propellers of innovations. Viruses are no different. Generally, sociologists have argued that centrality in social networks provides an advantage. Those at the center are more influential. Central actors connect across isolates, providing them with advantages. They get to have the good ideas because they get to listen to ideas from diverse places. They get to know more because they hear gossip from a variety of sources. Thus, sociologists define centrality as a social asset, as social capital. Social capital enables action just like financial capital. Indeed, those in central position can operate more effectively than those lacking connections. Sociologists say that those having more social capital, more friends that span different groups, enjoy advantages in terms of economic standing, promotions, and even longevity. This is why applied sociology and business administration teach people the skills of networking. They hold conferences with management experts and special software. But this is exactly where the corona strikes us. It proves that those enjoying social capital, those in central positions of social networks are A, at increased risk of being infected, and B, pose greater dangers to others. Paradoxically, those who have much more social capital are more liable than those at the fringes of social networks. Furthermore, sociometric stars endanger the groups they interact with. In ordinary days, they enjoy their social capital. In the days of the corona, they are both at high risk of being infected and also endanger their friends. Precisely for this sociological reason, politicians and opinion leaders are falling prey to the coronavirus. This is why we see movie stars and sportsmen in isolation. This is why politicians and public servants are in greater risk for infection and isolation. Angela Merkel's designated heir, Israeli minister, and yes, Bibi Netanyahu and Justin Trudeau should take extra precautions, and Harry and Meghan. If you see them, run away. It is true that elites enjoy health insurance and movie stars certainly get preference in treatment, but being central in their social networks, they also serve as virus connectors, as bridges that possibly move the corona from one group to another. The popular stars are surrounded by admirers, they shake many hands, they meet photographers and fans, thus they may be infected by more people whilst infecting more people. This is why central location in social networks allow the virus to jump from one head to another, from one group to another. Yes, central actors or sociometric stars connect people from different social circles. This is why their duality. They are more likely to become infected, but to that extent also serve as connectors, as bridges across different social circles. In doing so, they help spread the virus to groups that have so far been cut off. Take Donald Trump, for example. Reports suggest that until a week ago, he refused to treat the coronavirus as a significant risk and referred to the spread of the Chinese virus as a media event, almost like fake news. He regarded the virus as part of his impeachment. But then, after spending time at Mar-a-Lago at his golf course, partying with family and friends, it turned out that guests were infected by the corona. As a result, and in a surprising turnaround, Trump had been tested for the coronavirus. He then bashed advisors for telling him it was nothing. On Friday, he declared a national emergency, but then it became clear that the administration was maybe doing too little and too late. His Mar-a-Lago party connected various groups, possibly serving as a bridge between different communities. In this way, the American political elite, at least those at Trump's party, potentially transmitted the coronavirus from one group to another. Transatlantic high jumps. Paradoxically, homeless people endanger the public to a much lesser extent. The homeless are disconnected from social networks, so even if they are infected, they will create limited contagion. The virus will get stuck. Those most at risk, both at being infected and infecting others, are the middle class, travelers, tourists, and those from their communities who come in contact with them. Those who are at increased risk are those who work in hubs like airports, those who meet heterogeneous groups and connect across social boundaries, those who have traveled and met with foreign groups, those who meet at venues that connect foreigners, tourist sites or prayer houses or weddings in Israel, and politicians, of course. The same social processes put healthcare workers in trouble. At the same time they treat patients, they may also infect others. Medical workers meet diverse groups and therefore are at increased risk of contracting the virus. Because of their work, a bit like politicians, they act as connectors of social networks, like bridges. They connect different neighborhoods, they bring together different communities. On the one hand, they are particularly at risk of contracting the virus because of their meetings with suspected patients who come from different groups. On the other hand, once they are infected, they may also form the social bridge on which the virus will jump from one group to another. Paradoxically, thanks to medical hubs, the corona can jump from one group to another, thereby infecting different religions and neighborhoods. In Italy, for example, 8% of the patients are medical staff, probably a much higher proportion than their part in the population. This is why isolation policies are so critical, especially for healthcare workers. We must ensure that health workers have complete isolation from patients. They should be supplied with insulating clothing and full protection against contracting and transmitting the virus. We must guarantee that healthcare workers do not become bridges for the virus. social networks have power. But now we know that in pandemic situations, social capital and centrality may become a liability, a real risk. Already a decade ago, Professor Nicholas Christakis urged us to pay attention to social networks and epidemics. Link below. Listen to him and run away as far as you can to the fringes of your social network. Look at Serena Williams. Realizing how connected and interconnected she was, she announced that she was isolating with her husband and children for 6 weeks. Unlike our leaders, she took it seriously. But just as we need doctors, we need politicians too. So watch out up there, yeah? Beware, you are central and important for us. I wish good health for everyone, especially for those stars of the net, because the society needs political and religious leaders. From silent Boston, I am Professor Gad Yair. Want more? Let me know below. The footage, Apple Store, Boston. Very quiet now. Bye-bye.